Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, good morning. Welcome back to Insurance Matchmaking. The election's over. So if you were tired of all those commercials, guess what? Now it's all Medicare commercials. Seems like anytime I turn on the TV, there's going to be a Medicare commercial. And one of the strong points on that is the one I'm seeing the most is eHealth. That's a big competitor for me. You're just going to call into a call center, and they're going to push to change your plan. They're not going to try to keep you in your plan if that's the right plan for you. That's why you want to deal with someone local like myself. I always say, if you don't call me, at least call somebody local. We used to have a saying, when I was in the B&I group, we'd always say, friends don't let friends call 800 numbers. Get the hometown service, get the locals. It doesn't have to be hometown, but at least local. Someone lives here in Tennessee, works in Tennessee, and knows our plans here. That's who you want to talk to. We know about if doctors are leaving a network coming up or something like that, or just the fact of we know some doctors are like, yeah, they're in network with this plan, but they really would like you to have this plan or this plan. So those are some things that somebody at an 800 number is never going to know. They're just going to look at, and unfortunately, some of those people are bad actors. And they'll say, "Oh yeah, your doctor's in network with this," and you get your new card, and the primary care physician that's listed on your card you've never heard of, don't know who they are, don't know where they are. So I don't know how many times I meet with somebody and say, I'd love to make some money today, but you really need to keep the plan you have. So, and that's what you're going to get. And I think from most, if you're going to talk to a local agent, yes, we want to enroll you in a plan that we can get paid on. And that brings up a lot of the plans this year are not even commissionable. So it's like, even if we switched you to another plan, we might not get paid to switch you to that plan. But if it's still in your best interest, I'm still going to recommend it. I've got a couple people that I've put on a drug plan last year or the year before that this year is going to be, there's no premium for it. I'm not going to mention the name of the company because I don't like to say them. It's kind of like Harry Potter, the he who shall not be named. So we'll kind of go with that attitude. But if you're not taking any prescriptions or you just have one or two very inexpensive generics, that's the right plan for you. And it doesn't make sense. Now, there is another plan. It's like $27, and if I'm worth $27 a month to you to be your agent, then I can enroll you in that plan and get a little bit of commission on it. So, and that's up to you. If it's not the right plan for you, I'm not going to move you. After that rant, the other thing, I do actually have news. I mentioned the election's over. I actually halfway expected on November 6th we would get this report. We didn't. It was like a couple days later, I think it was maybe on the 9th, that the 2025 Medicare costs got announced. So just to kind of bring that up to date, I'm not going to go in the order it is on this sheet in front of me because that's not the way I always look at it. But I'll go ahead. I'll follow the sheet. I realize the order they're doing because they're talking about Part A. Now, this is not going to affect most people. If you have a Medicare Advantage plan, you have a copay for so many days in the hospital on most plans. There's a couple plans out there that work kind of like a Medicare supplement, and you do not have any copay or deductible for the hospital. But if you just have original Medicare, or you have a high deductible plan so Part A is not covered, that deductible is $1,676, and that covers you for days 1 through 60. If you're in the hospital for more than 61 days, you actually can have a per day cost of $419. And that usually doesn't happen, so I'm not going to get into the weeds on that. That's something we can discuss because, again, it doesn't generally affect anybody unless, and I'm sorry, it's at those end-of-life stages. When you're staying that long in the hospital, you're usually much older. They can't care for you at the assisted living, so they send you to the hospital. And most of the time, people they don't come back out. Sorry, a little realism there. So as I mentioned, you don't have a Part A deductible on a Medicare Advantage plan. Most Medicare supplements, you're not going to have that. If you have a Plan F, or you have a Plan G, or even a Plan N, you do not have that $1,676 Part A deductible. If you have what's called a high deductible F or a high deductible G, yes, you will have that deductible, and you'll have to come up with that if you're in the hospital. But most people, it's not going to affect. If you're in a skilled nursing facility, that falls under your Part A also, but usually on a Medicare Advantage is going to cover the first 20 days. Your Medicare supplement's going to cover it. But again, if you don't have a Medicare supplement or if you have a Medicare Advantage that cuts it off at 20 days, you're going to have a $209.50 copay. Now that copay could vary with your Medicare Advantage plan. They may not charge that exact rate, but it will be around that $209. So just kind of keep that in mind, that that's one of the gaps of a Medicare Advantage, that after 20 days, you may have to pay for skilled nursing, a Medicare Advantage plan, a Medicare supplement plan like Plan G or Plan F, or even Plan N. Those plans are going to cover those days after 20 days. So you still don't have to worry about copay for those hospital stays. But if you're on a Medicare Advantage plan, that's why sometimes we'll recommend that hospital indemnity plan you've probably heard me mention here a couple times, that will fall in and carry and reimburse you for those high copays, like a hospital stay, like an outpatient surgery. So those are some things, one of the reasons why we recommend looking at a hospital indemnity plan if you have a Medicare Advantage. Here's the one most everybody wants to know about, Part B, because everybody has a Part B premium. Now, if you're extremely low income and you get some assistance from the state, you don't have that Part B premium. But if most everybody else is going to pay that. It's been $174.70 this last year. It's going to be $174.10. I don't know why I keep messing up. Anyway, it's going to be $185 for 2025. And one of the things that I actually enjoy is I can say $185. I don't need to round it up because it's $184 and change. Or if it's $185.20, I just say one. No, it's actually $185. There are no cents left over on the Part B premium. It's going to be a $180. So the good news there is it went up some, but it didn't. It went up just right a little, $9 and something, or I think that's what they said. It was like $9.90 that it went up. $174.10 to $185. You can round it up if you want to round it up. It went up about $10. So yeah, that little bit of a raise you're getting on Social Security, yes, it usually gets eaten up pretty much by Medicare. The other big number that's very important to those that don't have a Plan F and aren't on a Medicare Advantage, they want to know about that Part B deductible. This year, coming up, 2025, the Part B, or I was going to say this year it's $240. So if you watch any of the YouTubes and things like that, a lot of people are, they're still talking about the 2024 numbers. That's what I'd been doing on the show here because I didn't have these new numbers. But the Part B deductible for 2025 will be $257. So if you have a Plan G or a Plan N or any other plan other than F, you're going to have to pay that Part B deductible before your supplement plan starts paying some of the other things. Now, of course, remember always with Medicare, whether you have a Medicare Advantage, Medicare Supplement, also the ACA plans, your preventive things are covered. So your annual mammogram, your flu shots, those kind of things are going to be covered at no cost to you. They do not affect the deductible. So those were some numbers. I wanted to get those numbers out to you real quick. The other is our friend IRMAA. And I always say it's not, you might remember IRMAA Bombeck wrote some funny books, and she usually had a little kind of satire column in the newspapers that would run like once a week. And, I think one of her books is The Grass is Always Greener Over the Septic Tank, something like that. So that was, I think that was one of her books. So anyway, but IRMAA stands for Income-Related Monthly Adjustment Amount. That's a surcharge that can be added to your Part B premium, and it also can be added to your Part D premium. And I say Part D premium because, again, if you take a Medicare Advantage plan and you're paying, you have to pay a surcharge on Part B, you're also going to get charged the Part D surcharge because it is included in your Medicare Advantage plan. So the only way you'd avoid that is have a Medicare Advantage plan that doesn't have Part D. And if you don't have other coverage like VA or federal retirement, I don't recommend going that route. But here's the numbers for IRMAA. If you're single, you're fine up to $106,000 of modified adjusted gross income. And remember, I've mentioned they like to look back 2 years. So they're going to look at your 2023 income. And that's where people get kind of caught sometimes, is they cashed out their 401k, or they decide, well, while I'm still working, I'm going to cash out some of my retirement funds and do that remodel on the house so we don't have to worry about trying to pay for that after I retire. My income goes down. Well, the problem is when you cash out those assets, whether it's early distributions from a 401k or IRA, or whether it's you had some money in stocks or mutual fund and you sell those off and you have a capital gain on it, that's going to push your income up. So be wary of that, to not do that before 63. Before you turn 63. If you're going to take money out, do it before then, because when you turn 65 and go on Medicare, you won't have that spike in your income. So that's one of the things to look at. Now, of course, the good news is I mentioned that $106,000. That's for an individual. If you are married and filing a joint tax return, then you can double that amount. So a lot of times what happens is, one spouse is making a substantial income, the other one is maybe just working part-time or not working at all, and so they don't have any income, or maybe they've, you got to be careful too. If you started drawing Social Security at 62, that money's going to get added to this also. So you just got to be careful about what you're selling. Now, if you sell your home and you move, that's usually not going to hit your taxes. But you sell a piece of property that's not your home, you may have some capital gains there. And again, this is something to talk over with your accountant. I'm not an accountant, but just kind of putting out that warning that you might have to worry about your income. I always apologize to the folks that come to my workshops that, when I get to this slide, I say, I apologize, I didn't know you 2 years ago. And they all give me a funny look, and then I explain how IRMAA works, and they kind of go, oh, okay, yeah, makes sense. So I've had a couple clients ask me about it, and when I tell them out, and they go, oh, no, that shouldn't be an issue. And that's why I love having the slide, because I can put the slide up and say, if your income falls in this above this threshold, you're going to have that IRMAA charge, instead of going, well, do you think, instead of asking me, oh, do you think you're going to have over 106,000? No, they don't want to talk about that in a information session. So it's nice to just have the numbers there, and they know whether IRMAA is going to affect them. So as I mentioned, Part B, if you're under the 106, $185 a month is your Part B premium, and there is no surcharge on your Part D. Now, if you're between 106 and 133, and as I mentioned, the numbers I'm going to give you now, I'm going to give for individuals. Just remember to double them, and you can figure that out for the married couple. And I realize I just looked at, I am coming up on my commercial break. So when we return from after the break, I'll get a little more detail in these IRMAA numbers, and then we'll go forward from there.
Hi, this is David Price, your local Twin Lakes Business Solutions consultant. The holiday season is here, and for businesses, that means more customers, more sales, and more online activity. Twin Lakes is ready to make your busiest time of the year the best time of the year. With gig speed packages and customized solutions for voice, video conferencing, and more, you can handle the holiday rush with ease. Give me a call at 931-476-2151 or visit twinlakes.net to learn more. Happy holidays from Twin Lakes.
Before Santa arrives, make room in your home by donating your excess items to Habitat Restore. Simply drop off your donations at 560 South Jefferson Avenue in Cookeville. Check off the rest of that Christmas list when you shop at Habitat Restore. Find great deals on home decor, furniture, appliances. Now open Tuesday through Saturday with extended hours until 6 p.m. Let Habitat Restore help simplify your holiday season.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, well, welcome back after the break there. We were talking about the IRMAA surcharges on the Part B premium. I'm going to kind of go ahead and start over so Part B premium for 2025 is going to be $185. That's the standard Part B premium. And if you earn less than $106,000 of your modified adjusted gross income, and that's for 2023 income, you don't have to worry about the surcharge. You'll be fine. But if it comes up in the next from 24 or 25 taxes, yes, they're going to add that surcharge in. And don't forget, the numbers I'm giving you are going to, for the thresholds, are going to be for a single person, married filing jointly, just double the numbers. So $106,000 or less, no surcharge. Your Part B premium is $185. Then there's no surcharge on your Part D. Between $106,000 and $133,000, then the Part B premium will be $259. There's a $74 surcharge added to your Part B premium, and there's a $13.70 surcharge added to your Part D premium. That's D as in drugs. And as mentioned before the break, if you have your Part D coverage through your Medicare Advantage, you are going, even though you're on a zero premium plan, you will have a $13.70 premium because you had that Part D surcharge. So sometimes I have a little confusion with folks think I put them on a zero premium plan and they say, why are they still taking it out of my Social Security? It's like, well, that's your Part B premium. That's Medicare. That's the part goes back to the government. They're going to take that part. You're actually getting quite a bit for that premium, because if you have a zero premium Medicare Advantage, just know that Medicare is paying that insurance company handsomely to be your insurance. The nice thing about the zero premium plans are if you don't go to the doctor, you don't spend any money there. Plus, you maybe have some free dental coverage, some over-the-counter. Some of them have food cards, and that's something I'm going to get into here in a bit after I finish this IRMAA briefing about the food cards. But there are benefits to Medicare Advantage that you don't get with a Medicare supplement, because Medicare does not cover routine dental, vision, or hearing. So sometimes you get some extra benefits on Advantage plan. But I'm getting off of what I was talking about. So between $133,000 and $167,000, that's the second level of IRMAA, and your surcharge would now be, basically it will double your Part B premium. It's going to go up to $370. So it literally is double the normal Part B premium, in the surcharge for the Part D, again, as in drugs, will be $35.30. From $167,000 to $200,000, that surcharge adds another $295.90 to the surcharge, or to the Part B premium, for a total of $480.90, and the drug coverage surcharge is $57. They figure, well, you make a lot more money, you can pay it. But unfortunately, sometimes it's those people that did something, didn't roll over that 401k when they left a job and thought they were done when they paid the extra income tax on it at that time, and then they go on Medicare and it comes back to haunt them. From $200,000 to $499,099, then your surcharge will be $406.90 for a total of $591.90, and the drug surcharge is $78.60. And this is why that $499, because $500,000 and above, and I've said before, double these last couple ones is not a double, because it's $500,000 or $750,000 for a couple, so you don't get all the way up to $1 million at the $500,000 level. So the total would be $628.90 for your Part B. That's a $443.90 surcharge added onto that $185, and the drug surcharge is $85.80. Generally, I figure it's like some of the people, if their income is there, they probably aren't bothering to buy drug plans anyway. They're just paying for their prescriptions, so they're probably not going to see that surcharge. But those are some things to be cautious about. And like I said, I like to give out the whole numbers. Most people I talk to are not going to be that 500,000 plus, but I have ran into a couple people that are worried about hitting that first level. So it happens. But usually people who are maybe a higher income, they probably have discussed a lot of that with their financial planner, and maybe their financial planner has already put them with another agent like myself, or maybe they handle Medicare too, or they have someone in-house to do it. So wanted to brief that with you. So I've said I was going to talk about the food cards. That's the other thing. I saw one this morning. I don't know how they're getting away with it, but I've been seeing a lot of ads on YouTube. I haven't seen them. They're not on TV. You might see them on Instagram, TikTok, Facebook, some of those where they put out just a video, quick video or whatever. But YouTube is where I'm seeing them. And they're talking about, oh, if you're a senior, you got till this Friday to get this food allowance. And the one that really irritates me is she says everyone on Medicare is entitled to this. And that's absolutely false. There are food cards out there. There are legitimate food cards. Most of the ones you see, they're usually going to be about $50 a month. And then again, even those are usually going to be on the plans for people of the lower income that they're reaching out and making, because that's a very competitive market for the Medicare Advantage plans, because they get some extra incentives from CMS to cover those people. Or if they're on Medicare and Medicaid, they're not having a bunch of expense, because the Medicaid is picking up like a Medicare supplement, so they're not paying for all of the health care. So they're very generous on those extra benefits, and also some of the plans that are designed to attract military and federal retirees that don't need a health plan because they have their federal retirement, but they may have Part A and B, and a Medicare Advantage can actually fill some of those gaps, especially, hey, who wants to pay for dental if you don't have to pay for it? And that's one of the things you can do with the Medicare Advantage that doesn't have the drug plan, because you have drug coverage through whatever retirement program you're with. And like myself, I'm on TRICARE for life. I have my Express Scripts. So if you're like me, I also have a Medicare Advantage plan. I don't mind sharing that. I'm greedy. I don't want to have to pay for my dental plan. And because I'm an agent, I'm my own agent, and I get paid for being my own agent. So why wouldn't I sign up? So those are some of the things with the Medicare Advantage. But these fraudulent commercials, and they're not just Medicare. That's what they're pushing right now, because it's the Medicare enrollment season. And I always tell people, if you like your Medicare Advantage plan, you didn't get anything from your insurance company saying, hey, this plan's going away, you won't have this plan in January, or they made some major changes to their plan. Hopefully you saw that. Everybody should have gotten what's called an annual notice of change. It should have got that in September. So if you haven't thrown all your junk mail out, go and look for the junk mail that's branded from your insurance company, whether that's Blue Cross, Humana, Cigna, Aetna. Some of our listener area may have Devoted. Devoted is not in Putnam County, but it's one of the companies I represent. If you didn't get that annual notice of changes, it's available online. You can call customer service and say I didn't get a copy. So those are some things we can help you figure out. But the only one I'm concerned with is if you have a Medicare Advantage plan, if you take a lot of prescriptions or you have brand name prescriptions, let's take a look at that Medicare Advantage. It's not going to be the same next year. But the good news is we also have that time period, what's called the Medicare Advantage open enrollment. From January 1st to March 31st, you can switch your Medicare Advantage plan. So it's not that critical for us to review your Advantage plan by December 7th. Your drug plan, on the other hand, it is very important that that's reviewed between now and December 7th. And with a lot of the changes with the maximum out-of-pocket being instituted since the Inflation Reduction Act, where you have a $2,000 maximum out-of-pocket on your prescription coverage, that only applies if that drug is on your drug plan's formulary. And they do not have to keep, just because it's covered this year doesn't mean it's covered next year. So that's something you need to review. And that does have to be done by December 7th, because if you don't change your drug plan between now and December 7th, you're going to have that same drug plan this time next year, because you didn't change it for January 1st. So it's very important to review that drug coverage. The deductible's gone up on Part D. It's $590 this year. Most of your standalone drug plans are going to cover that. And I don't usually like to mention company names when I'm doing this, but I am going to mention a couple here. Aetna, also known as CVS or Silver Scripts. If you have a plan with them, they're only offering one plan next year. So if you had their low $750 plan, now because what they're doing is anybody who had one of their plans is being enrolled in their one size fits all plan. I never understood a company why they would do a one size fits all on their drug plans, but that's what they're doing. So if you had the Saver plan, your premium's going up. It'll be a good plan, but you're going to pay more for it. So that's one of the things you want to be careful of. The other is if you had a Mutual of Omaha Part D drug plan, that plan doesn't exist next year. So you need to get another drug plan in place, and we need to do that before December 7th. I've worked with like 3 people this week that's what they had. A couple of them I think I put on the plan. The other one I think they had it already, but you should have got a notice. And actually, the lady that come in yesterday was concerned. She thought it was her because she has a lot of prescriptions. Like, no, they're not canceling you. That plan just doesn't exist anymore. So she left much more peace of mind, and we got her plan. It's going to cover her and cover her prescriptions very well. So she's happy and good to go. And like I said, other 2 clients, I was able to go ahead and get them enrolled in a plan for next year, so they won't lose drug coverage. So that's, like I said, I don't usually get into the company names on that, but I did want to make sure that you knew that about those drug plans, because that deadline, it is a hard deadline unless you qualify for some other special enrollment criteria. So anyway, that's the drug coverage. Give us a call. 931-881-3969. Myself or Bree can help you figure out. And anybody you talk to at our office, they can get you set up to where we can get an appointment with you, whether you can come into the office or we set up a video conference through Google Meet or even a phone call. But one of the things they will ask you to do, we're going to send you a link to a form, and it uses a program called Retire Flow, and it's a really easy online survey where you can update us on your drug list. You can update us on your doctors, because sometimes it's going to be a Medicare Advantage we're looking at. If you're just wanting us to look at your drug list and you're not interested at all at looking at a Medicare Advantage, you can skip the doctor part. It doesn't matter because you're on a Medicare supplement. You can go to any doctor, any hospital. It's just be your drug coverage. And in the third part of that survey is what's called the scope of appointment. Medicare does require us to have that 48 hours prior to your appointment. So, and it's pretty simple. And the one thing, the drug part is really easy. You know, you have to type in like your name and your address, phone number, email, and then when you get to the drug part, you just got to type in like 3 to 4 letters of the drug name, and then it's going to give you some options to pick the right one, and that way we get the drug spelled correctly. Be very cautious when you're looking at like the milligrams of your dose. Make sure whether if you take a capsule or a tablet that you select the right one, because sometimes a drug plan will one of the drugs will have 2 versions. You can get a capsule or a tablet, and sometimes the insurance company won't cover the capsule or vice versa. And so it'll skew our results saying, oh, this plan's not going to work for you. They don't cover your drug. And then we realize, oh, they really do. It's just that it's the wrong number. So anyway, we're coming up on the end here. So remember, insurancematchmaking.com. You can always reach out to us through that. MattLibbyInsurance.com. We are at 1683 South Jefferson next to Domino's. So come see us, call us. And until then, see you on the radio.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.